Hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're going to go over, is vertigo coming from your neck or not? So this is for the patients that are complaining of vertigo or even dizziness, and they've been to the physicians. They got the CT scans and the MRIs already. They got the consults with the ear, nose, and throat physician, and everything comes back negative, okay? There is a possibility yet that your dizziness could be, or your headroom spinning and the dizziness symptoms can be coming from your neck. It is rare, but I've seen probably in my years of practice, probably 4 cases total. And we had a case recently where they were at the Mayo Clinic. They didn't know what caused the dizziness. Certain arm motions or turning would have caused dizziness. They ruled out BPV, they ruled out Meniere's disease, they did the brain scans, the MRIs, and everything came back negative. And they didn't know what to do. So the interesting finding is that when I touch the neck or the neck muscles that are in spasm, or we do neck motions, it actually induces dizziness. And it was an interesting finding. And there was one case that I had a couple years back where the patient was having neck pain and dizziness. They just ruled out the dizziness. They didn't know what was causing it. The patient got a neck fusion and the dizziness went away. But then with time, the dizziness started to come back. And she actually went to the physician and was like, hey, whatever you guys did, it helped my dizziness. And they were like, we didn't even know what was going on with that. We didn't fix that, we didn't cause that. But when I treated the neck is when the dizziness started to go away. Okay, so it's called a cervicogenic dizziness. It's very common to be associated with neck pain or even a cervicogenic headache, where you may have a headache also that's coming from the neck. There's many different theories of why this happens. You know, a lot of times necks, like the neck muscles are hypertonic. There's dysfunction or hypomobility there too that are also common with it. But the key finding is neck motions, or when you palpate certain muscles, it causes the dizziness. Okay, it is rare. It is good to take those first couple steps to rule out anything major, but with all the scans and stuff like that. But when everyone tells you your MRI findings are negative and all the diagnostic testing is negative, there is still a rare case called cervicogenic dizziness. And the way that you'll know that it's coming from the neck is when you treat the neck, the dizziness starts to go away. The good news is, the bad news is that it's rare. I haven't seen many cases of this. The good news is all 4 of the cases have responded great with almost 90 to 100% recovery of the dizziness, and they're doing much better without medication. So just to recap, there are a few cases called cervicogenic dizziness. It is rare, but it is common, especially for those patients who have been through every kind of diagnostic testing, but everything comes up negative. The key finding with this is going to be when you get treatment to the neck, it decreases the actual dizziness. And the outcomes are fairly good if you can solve this problem. So thank you for tuning in. If you or someone that you know is dealing with dizziness that you guys don't know the cause yet, you can give us a call at 407-494-8835 or visit us at pursuittherapy.com. Thank you for tuning in today, and I hope you learned something, and we are here to help if you need us. Thank you.